Vishakha. I'm 28 years old and I'm from Mumbai, India. I came across palliative care in 2016 for my mom, who was a cancer patient. While she was a cancer patient for 11 years, unfortunately in 2016, her cancer had metastasized pretty rapidly, causing her condition to deteriorate as well. At the time, I was 23 years old and I was the primary caregiver for my mom, and was finding it extremely difficult to be able to deal with the symptoms that were coming up as a result of the side effects of her cancer medication. These were symptoms that were seemingly, they didn't seem very important for her oncologist or for her treating doctors, but these were the symptoms that were causing her the most pain and suffering. Things like nausea, pain, bed sores, these were loss of appetite. This was causing so much suffering for her that we couldn't bear to see her in this position, and all we wanted to do was give her a better sort of quality of life at that point in time. That's when we found out about palliative care. Pallium India put us in touch with the palliative care department at Tata Memorial Hospital here in Mumbai, and that honestly transformed our entire caregiving journey for my mom. They were extremely helpful in helping us treat the different forms of symptoms that were showing for her, right from how do you treat bed sores, how do you treat nausea, how do you assess pain levels and administer drugs accordingly for that. These were things that the doctors in the corporate hospital that were treating mom's cancer were not able to effectively explain to us, but the palliative care doctors could. As someone who was so young and taking care of my mom, and things would change very rapidly, it was also amazing to know that these doctors would be there for me whenever I needed it, even if it was at 3 a.m. in the morning. I would highly recommend it for anybody who is going through a similar situation or can foresee themselves going through a similar situation as well. One thing that I also really appreciated was the fact that the palliative care doctors also helped us prepare for a more decent and holistic goodbye with our mom. Unfortunately, she did pass away in 2016, and I think that these are some of the biggest takeaways that I took from the palliative care journey and experience that we had. Thank you.